So good afternoon. Um, my name's Kim Lyerly. I'm one of the final speakers, so you'll be happy to hear me coming, and I'm much to my chagrin, probably happier to see me leaving. It's been a fantastic day. I think we've had some incredible highlights. Richard Moore's speech was not only informative, but it was very moving, and I'm sure many of you will remember it. I know that I will, and hopefully I'm excited to share my thoughts about it to my family and to my colleagues. I'm happy to really be here for a couple of reasons. One, I'm excited about sharing a little bit of our work on the environment and health. But I also want to acknowledge a couple of people in the room that perhaps haven't had the kind of recognition they typically get. One, June Blotnick, the Executive Director of Clean Air North Carolina, that has been a steadfast supporter of health and the environment in North Carolina, and again, really a fantastic organizer and an incredible person. So June, thanks for all of your efforts through the day and the year. And for those of you who don't know, this is one of June's last official functions because she's going to retire from her role as executive director. And again, it is a great loss, but again, I think a great tribute to her that the organization is on such solid ground and is doing so many fantastic things. So June, thanks so much for all that you've done. And you'll hear more from June. And again, I didn't want to embarrass you right before then. The other person I want to acknowledge is, Fred Standback. Alice is, his wife is not here, but Fred is one of the reasons I had a lot of interest in the environment and health. And it really started when I was the director of the Cancer Center at Duke, about 20 years ago now. And at that same time, there was a huge focus on genetics. And everything that was related to health and cancer in particular was genetics, inherited genes, if your risk of cancer was going to be passed on by your families and so forth. And so there were a number of registry studies done in the Scandinavian countries where they would have tens of thousands, hundreds of thousands of identical twins. And they would follow the health of these identical twins. And as you know, a fraternal twin is one in which you have two infants in the same or more in the same uterus. But an identical twin, a monozygotic twin, is one in which the egg really splits, and then that fertilized egg splits to form two genetically identical individuals. And so for the geneticist, this was, of course, a fantastic experiment of nature to look at the risk of cancer in someone who had a genetic twin who had cancer, because the assumption would be this is really going to provide proof of the genetic basis of cancer, and the expectation would be, of course, that if your identical twin had cancer and you happen to not be killed by a mountain lion or a bolt of lightning when you were 15 or something, and you lived to be 75, 80 years old, you would also have the same genes, you would have the same health outcome. And it turned out that the risk of a cancer, if your identical twin had cancer, was only about 5 to 10%. 5 to 10%, much lower than people had expected. And the conversation I had with Fred at the time was what was the potential cause of this disparity in the background genetics of an individual. And the reality was, and probably is today, that the environmental exposures of that individual over the course of that lifetime had to be different. And these environmental exposures probably are a much greater contributor to the development of cancer and other health diseases than perhaps heretofore really thought of. We thought about this a lot. We know that, for example, cigarette smoking, which is now considered to be unequivocally associated with lung cancer, in the scientific literature, probably due to lobbying by the tobacco companies, I almost said pharmaceutical companies, it took about 30 or 40 years for the Surgeon General to finally proclaim that cigarette smoking was related to lung cancer. And the probability of lung cancer, if you are a heavy smoker, is massive compared to environmental exposure. So we thought, well, gosh, if we follow a traditional method of trying to prove the impact of the environment on cancer, and it took 35 years to get anybody to believe that lung cancer was caused by cigarette smoking, we are not going to make any progress. We are just going to be doing research and dog paddling and not making any progress at all. So one of the things that Fred had mentioned to us was, like, we have a big center. We have 500 scientists working at Duke, and we're all working on computational biology and mathematics and big data and so forth. Is there a way to begin to associate environmental exposures, environmental data with health outcomes? And again, being at Duke, which has the sort of capacity to have multiple schools, including one of the few schools of the environment in the country at that time, again, we could begin to do that kind of work. So this afternoon, I'll spend a few minutes telling you about the work that started from that conversation, that recognition that our health was influenced more than just our genetics. It was influenced by our environment, and hopefully provide a perspective of that journey, as well as the very personal journey that many of you have heard about earlier, about the environmental justice narrative that started in Warrenton County. And this is a slide from the Washington Post article about the environmental justice and the birth, and it really talks about the timing of that. So looking backwards, North Carolina's air quality and health policy making. Can we go to the next slide, please? So 50 years ago, this was 1990, early 1990s, would be the birth of the environmental justice program, in the sense of true policies set up by the White House. But 50 years ago, during the time of these protests, what was the world like? And what I was trying to do was think of an iconic device or placeholder in history that you might think about. And so what I came across was the Time magazine cover for Person of the Year. As you know, every year Time magazine has a Person of the Year. But this particular year, 50 years ago this year, the Person of the Year was replaced by a machine, and the Person of the Year 50 years ago was the personal computer. Now, 90% of the people in this room can't fathom a world without a personal computer. I mean, you're all carrying one in your pocket that is, 1,000 times more powerful than this computer on this page here. But there were no computers. The way you communicated with people is that you went to the phone in your house that had a cord on it, and you dialed somebody, and if they happened to be home, you got to talk to them, and if they didn't, you didn't. And you waited around to see if they would maybe call you, or you would leave a message with their mom or their brother or whatever. But the world was very, very different. So think about the change in our world, the ability to have a phone, to drive an electric car, to be, on a conference today with people from all over the country that are, audibly and visibly in the moment with all of us. That's the type of change that can occur in your lifetime. That's the type of dramatic shift in communities and nations and the world that can occur. And that's the type of change that has occurred over the past 50 years. So next slide, please, or the animation. 50 years ago, from the Washington Post, these protests about dumping again, the photographs are really striking from the Washington Post. Obviously, all of you can go onto Google and find these. But I was really struck, again, by the sense, the imagery, the protests that seem very similar to the civil rights protests from the 60s and the 70s. Again, environmental protests about this injustice. Next slide, please. So again, the protest down in that left lower corner for you started around 1982. Again, it set the stage for the Office of Environmental Justice, and again, what a pleasure to have Richard Moore, one of the originators of this movement, with us today. But you can see there's an entire office at the EPA, and they're very proud of the efforts they have been making and the successes they have had in addressing this. This is from their webpage, and this is some timelines there. But I wanted to put a couple of other timelines on there. Next slide. Yeah, in 1992, again, the office was officially constituted, and it probably most importantly had some funding to go with it. And this is a key thing with the government. They can do lots of things. If they don't provide any financial support for whatever they say they're going to do, nothing actually can get done. And that's, again, an element of policy that for all of us we have to be aware of. People can say they're going to do lots of things. They can make announcements. They can, name names. They can name offices. But until the funding is associated with that activity, nothing really happens. The next slide I'm going to show you is this 2001. Again, only 10 years after this EPA Office of Environmental Equity. And 2001 is I think a nice year for North Carolina, because this is the year that the Clean Smokestacks Act was passed. And this was a legislative action that really addressed air quality in North Carolina. Next slide. So the 2001 Clean Smokestacks Act, this was a process that took the sitting Attorney General of North Carolina at the time, Roy Cooper, who now happens to be the governor of North Carolina, as well as William Ross, who was the Secretary of the North Carolina Department of Environment and Natural Resources. Working together, they actually had to file a lawsuit against the Tennessee Valley Authority because of the impact of the pollutants from the coal-fired power plants on the air quality in the Smoky Mountains, in which visible particulates and the absence of the vistas that are so beautiful there were, very obvious signs that the air quality was diminished due to these processes. Nonetheless, it took really not an act of Congress, but an act of the North Carolina legislative bodies to create a law that didn't just simply request that there be a reduction or to suggest that they could exchange carbon units for something else, but they really provided a legislative framework in which specific reduction in the pollutants and the tonnage of pollutants that could be released had to be accomplished. And the penalties for not accomplishing these types of activities would be so severe that the sort of utilities had to act. And as you might imagine, the magic of reducing the pollutants from carbon combustion from a coal-powered power plant wasn't so much a magic wand coming up, but mostly shutting down the power plants because it was too dirty to really function. And for those power plants that were less dirty, the capacity to put in technologies such as scrubbers to reduce those particulates. And again, a very, very fine narrative about the Clean Smokestacks Act that was sort of celebrated just in the past week or so because of the 20-year anniversary of this act. Next slide. Well, as you can imagine, many people were paying close attention to the level of air pollution following the passage of this bill. And so the expectation was that with the tonnage of pollutants being reduced, then the air quality should be improved because the pollutants in the air could be measured and that should be, reduced. And in fact, this was an area of focus of many of the environmental scientists, is to confirm that the air pollution was being reduced due to the reduction in carbon combustion emissions from these coal-powered power plants. And again, some of the sophisticated analysis suggested that the quality of the coal could be so poor that there were other benefits, for example, the reduction in sulfur that wasn't required, but just because, by reducing this coal combustion, many other heavy metals were reduced. So this was all well and good, and this was very exciting, but to Fred's point, one of the things that we thought about was, well, we know that the air looks better and the air pollution levels seem to be improved, but oddly enough, at this time, when we started looking at it in the early 2000s, no one had ever demonstrated that the assumed benefit of the improved air quality, which was that the health of individuals would improve, had ever been demonstrated. People, I guess, assumed that it was going to happen, and I think we would all imagine, that seems to make sense. But we took it upon ourselves to say, well, let's look at the health outcomes in the 10 years before the Clean Smokestacks Act and the 10 years after the Clean Smokestacks Act. We'll look at the air quality in those 2 decades, and we'll look at the death rates from diseases that we think would plausibly be associated with poor air quality. So let's do that. Next slide. And again, this is where we began to use some of the big data analysis and the tools and the data that actually existed within the state already. It turned out that the environmental scientists had massive databases that we could measure air quality, but the health services also had massive databases about health outcomes. And these health outcome databases and the environmental databases never talked to each other. So there was no association. So we had to build computational models and computational tools that didn't interview one patient, didn't send out one survey, didn't swab one throat, but looked at databases for the data that existed within the state at the time. And we mapped, go back one slide. We mapped the death rates from emphysema, asthma, and pneumonia, as well as, you can imagine, the ancillary hospital visits, ER visits, et cetera. But I'll show you the final results that are displayed here, is that there was a dramatic reduction in the death rate from emphysema, asthma, and pneumonia in North Carolina the 10 years after the Clean Smokestacks Act was passed. The national average, the national death rates from emphysema, asthma, and pneumonia didn't change at all. It was only in North Carolina where this dramatic reduction in air pollution occurred that we saw these benefits. And these benefits, again, think about it, the benefits in reduction in death, these were tens of thousands, 20, 30, 40,000 potential deaths per year that were prevented every year. And that economic benefit was never calculated because there was never a link between the improved air quality and the health benefits that occurred from that. So again, by taking a different approach to think of a lens in which you can say, not just assume that the world will be better if the air is cleaner, but to think, what benefits do we expect to see? And let's demonstrate that we see those benefits is the lesson we learned from this. We had a very difficult time publishing this paper because, as we heard earlier, the academic world was, well, you didn't have an epidemiologist do a survey. You didn't have this type of analysis done. But we actually used the data that we had. And this represents 10 million lives in North Carolina. So that is a very difficult set of data to ignore. Well, we're quite pleased that a year or so later, a more traditional epidemiologic study was also conducted, and they demonstrated exactly the same findings. And we're very pleased now that even on the North Carolina state website talking about the Clean Smokestacks Act, the reference to the benefit is actually this paper that's on the website that really was the first demonstration of the human benefit of improving air quality. Next slide. So it's a great story about benefit, and I think one of the conversations we heard earlier would be, well, let's try to be positive in our thinking sometimes, and finding that right balance. And you know, I think there's probably some truth in that. People like to have good news rather than bad news. And so this story, the economic modeling demonstrated that there should be an economic benefit just due to energy, but when you add in the health benefits, it's a massive, massive plus for improving society, a financial benefit to the state, as well as to the utility companies because of their ability to decommission some poorly efficient power plants. But I think one of the things that I thought about as I was listening to the young people talk about policy change and moving forward is that the lessons from you know, this one example of success. And this is from Pete Andrews, who's a professor at public policy at UNC, who did a thorough analysis of this act. Again, a very unusual cross-cutting alliance of the variety of parties, because there was not only individuals who lived up in the Smoky Mountains, there was people who had made their money from the tourist industry, people who, you know, were worried about their family's health, again, the utilities as well as far as achieving efficiencies, a set of stakes that would provide each party the ability to negotiate and receive some benefit, and these were economic benefits provided to the utility companies. Again, I think this is the key to potentially the future creative problem solving. How do we find different ways, different solutions? How do we move forward from an impasse that oftentimes we find ourselves? And I think it gets down to that final point, good faith negotiations process. You know, this sense of respectfully hearing other people, seeing their views, finding a common path forward. And again, this is where I think we might have opportunities, using the contemporary tools to create sufficient knowledge and granularity that people can see the benefit and be convinced of the benefit, rather than, you know, the more common terms sometimes that we know it'll be better. We know this is going to be better for you and better for the community. I think we have the capacity now with these incredibly sophisticated tools to be very specific about the benefit we should expect based on these examples of previous successes. You know, how is society going to be better when we make this improvement? Here's an example. We expect to see the same magnitude of benefit with what we're proposing moving forward. Next slide. So one of the things that we had learned doing that analysis 10 years ago was, again, the power of mapping and the granularity associated with attaching data to specific geospatial locations and so forth. And so one of the things we began to do is to dissect out, you know, the state into specific regions, because even though there was such a massive reduction in air pollution that the entire state benefited, we thought it was probably more likely that some regions of the state benefited more than others. Probably if you had a house down at Kitty Hawk and they stopped the coal power plants in Nashville, it probably wasn't going to affect your life that much, and it probably didn't. And so we began to use these mapping tools and began to explore other environmental perturbations that were more geospatially distributed rather than temporally distributed. So the Clean Smokestacks Act was a really great experiment. 10 years of poor air quality, 10 years of improving air quality. What's the difference? That was not that tough to figure that one out. This one we began to map out to, again, zip code level regions of North Carolina. There's about 100 counties in North Carolina. There are about, 800 zip codes. So we have, might be 8,000 zip codes, right? It's a orders of magnitude more zip codes and counties. So rather than using a county level, distribution of health information, we can actually reduce it down to the zip code levels. And you can see when you get down into the zip code levels, you can begin to see the granularity of specific environmental perturbations. And in this case, we thought we would look at some of the hog farms because of the massive impact they had on our society and our economy. And again, the stories we heard about where hog farms today were being used. Now, North Carolina is number 3 in hog production at the time. It might be going up in rank. But the other states that had high hog production, Minnesota and Iowa, they were very different because they had a cooler climate, and they never really had the massive commercial feeding operations that North Carolina has. So North Carolina would produce hog farms that would have millions of animals. And the waste production from a hog is approximately 20 times the waste production of a human. And so if you had a 2 million person city, again, the equivalent as far as waste production would be a 10 million population city, you would have a sewage treatment center. You would have some kind of process in which all of the sewage from that population would be managed. But in the hog farm industry, what was mandated is that you could put it into a lagoon and to spray it into the air to let it desiccate. So imagine if we had that level of, there are not that many cities in the United States that are that big. I mean, this is an enormous population, and there's nothing else in the world like that except in North Carolina. So if you look, the screen was shocked by those figures. So if you look at the map of North Carolina, you could see this concentration. Again, we heard Sampson County, Duplin County. These are the regions that were economically, socially, racially sort of concentrated with those who were more marginalized. And so if you look at this map, see where the hog concentration, the concentration of hog farms exist. You can see they're concentrated, again, around Duplin County. And on the right side of the screen, or on your left side, is Julia Korshenko, who is a mathematician and a physician from Belarus, who had spent a lot of time working on the health effects of the Chernobyl disaster, and so had always had a long interest in the geospatial, health impact of environmental perturbations. And we actually published this in the North Carolina Medical Journal, sponsored by the North Carolina Institute of Medicine, and June and I sponsored an issue of the North Carolina Medical Journal on health and the environment because there had never been one before. And so we had to twist their arms and convince them that health and the environment was important for physicians to know about, but they said, well, if you commission the issue, we will publish it and we'll allow you to focus on it. But we don't, why would we ever do that? We've never done this before. So we're fortunate enough to actually use this journal to publish this report on the health of communities surrounding these commercial animal feeding operations. Next slide. And again, right as this publication came out, we had these massive hurricanes in North Carolina, and on the national news, there was a massive concern because of the overflow of these lagoon pits, these hog farm lagoons, into the surrounding communities. And right as our paper had come out, we had massive media attention to the report that the health effects were incredibly detrimental to those communities. And so this was from the New York Times, pit after pit of manure spilling over in the flood. Again, an aerial photograph of one of these commercial animal farms with the lagoon pit on its side. And this is some of the data that we had published along with this paper. And this data, we looked at a number of health effects, but this is one that we thought was quite interesting. the risk of dying or being in the hospital from septicemia or a blood infection, a serious blood infection, was relatively low in the average U.S. population. In North Carolina, it was slightly greater. But if you lived in a community that had a hog farm that was represented one of these commercial hog farms, you know, your risk of dying was 3 or 4 times greater. If you had a comorbidity, for example, a blood infection, you happen to have hypertension and kidney disease, you know, the risk of dying, you know, nearly doubles, again, for you know, all of these chronic conditions, anemia, kidney disease, et cetera. So as we heard earlier, it's not so much that, you know, Superman or the healthiest communities in the world couldn't withstand some exposures, but we take these marginalized communities, there's food deserts, there's lack of access to health care, they don't have access to the diabetes meds and their hypertensive meds and so forth, and then we expose them to these environmental perturbations, and the environmental exposures aren't to the healthy individuals who happen to be working in the commercial plant and are strong enough and healthy enough to do that work. They're in the elderly, in the small children, in the incapacitated that are in the communities. This is the exposure they have, that they have no capacity to withstand sort of these insults. And so, again, you can see, you know, massive increase in a variety of health conditions as far as ER visits and death. Next slide. Well, one of the things I was fortunate to talk to you know, Richard Moore about was, you know, what is our responsibility? We're doing everything on a computer bank, and we're looking at data and we're trying to find associations, but we need to do more than that. We need to find pathways forward to engage these communities, to respectfully work with them, talk with them, find out how to problem solve together, offer some recourse. For example, in our discussions with communities about kidney disease, part of our research planning was to have a discussion with the hospital systems to say, if we're screening for kidney disease or hypertension, how do we get people to be treated for them? How do we gain access to care for these individuals? And this is not an easy conversation. This is an ongoing process. The people in this room, the young people in this room, the requests for change, you know, some of them might be these very specific requests, which is if we identify health effects, if we identify inequities, what are we going to do about it? What are the responsibilities of the communities that are surrounding these and benefiting from these commercial operations to these communities that are suffering? So one of the things we had asked about was, we'd been asked about was some of the cancer risk, and so we did an analysis. We looked at a common form of uterine cancer. Oddly enough, this is a form of uterine cancer that has a massive disproportionate impact on African American women. So what it turns out to do is that when we do this analysis, and we were again getting more and more sophisticated, we now can give you your risk of death or hospitalization from a cancer based on how close you live to the hog farm. And if you look at the table here, if you're 20 kilometers away, you don't really have a much higher risk. If you're 10 kilometers away, your risk kind of goes up a little bit, 5 kilometers, and then 2 kilometers, you know, about a mile and a quarter, you know, you have, if you're African American, you have a 40% increase in your potential for dying from this uterine cancer. But what was interesting in this analysis, if you were Caucasian, you had a 65% increase in your death rate from uterine cancer. So again, this is not just reflective of any one population. These environmental exposures affect everybody. It's just if you are exposed and if you are living in these communities, you are going to suffer from these health effects. Next slide. So again, how do we move forward? We think currently there's an opportunity to actually look at the microbiome, the bacteria in our skin, the bacteria on our front lawn, the bacteria, you know, on the mailbox in front of our house. we can measure the type of bacteria that are there. We can genetically barcode and sequence them and find out if they're identical to the bacteria that should only be in pigs. We can find bacteria that are more likely to be resistant to antibiotics. There's a ton of stuff we can now do currently, and we're beginning to explore how to respectfully engage in these communities, find out, what are the bacterial components that are in their communities, and move forward. Next slide. And you can see, again, there's a very sophisticated approach. We must have lost that slide. But let me finish up with this last slide. And so again, as I mentioned before, we started out with a massive temporal spatial relationship in which bad air and good air occurred over 2 decades. We were able to analyze that, and that seems like many people have confirmed those findings. I think the hog farm studies we did a few years ago, many more people are doing studies and doing additional studies, and we think there's capacity to do very sophisticated studies in these populations. But again, respectfully, as colleagues, as partners, bringing benefit as well as research. That it's not a research project. It's addressing a community need. That's the approach we need to take, and that's the approach we want to take, with your help. But this is one, again, if we can begin to extend these things. This is an analysis of the PM2.5 we heard about. We look at PM2.5 in North Carolina. We look at the access, through the Charlotte sort of area in which we see many of the traffic patterns associated with the PM2.5. And now we're looking at the impact of PM2.5, not simply on asthma or emphysema, but neurological disorders, chronic neurological decline, Alzheimer's disease, Parkinson's disease, non-Alzheimer's dementia. So we see an increase, again, statistically increase as you move and live closer to these regions in which the PM2.5 is clearly measured and again, justified because of the traffic patterns and the other, elements of environmental exposure to them. So these are just been published. Again, most of this work has been done in North Carolina, but we have extended it to other parts of the world, other hog farms, other regions that have an interest in these types of analysis. Again, I think my hope today was to show you, a fantastic story of success with the Clean Smokestacks Act, tell you that there's so much to do and so many opportunities to make an impact, and remind you that, 50 years to all of you, to most of you, I'll say, I won't say all of you, is not a blink of an eye, but for those who've lived through 50 years, it is a blink of an eye. The saying with our 5 children, the days are long, the years are short. So it's going to happen very quickly. It's going to happen as you blink your eyes. So I'm so excited to hear about the enthusiasm and the drive and the purpose all of you have in making a difference, because I know you can. Thanks very much.
Kim, it's kind of interesting because I think it was about, 20-some years ago in the mid-90s, we were holding the North Carolina Watershed Conference right here in this location. And that was the big topic, was exactly the issue, yet there's not been a lot of change. And I really would like to hear from both you and Richard on what are the real roadblocks that we need to overcome, and any suggestions. I know outside of just, you demonstrated some of the research and where we need to go, but how do we translate that into action? How can we make the difference it needs to make?
Well, I think that's a great question. I think that's the, as we think about taking steps forward, to me, it's foundational knowledge, an understanding of what we need to do, to make a difference, and then finding, the pathway forward to make that happen. Some of it is, political will. Some of it is, economic, realities. One of the things I would say that I see is young people and their openness to change, their willingness to look, at who they are and so forth. And my daughter's transgender, and so we spent a lot of time thinking about the communities and things. And it was interesting, there's a Pew survey that if you were born 50 years ago and you got surveyed, did you identify as LGBTQ, the percentage is 0%. And if you're born 40 years ago, the percentage is 0%. And if you're born 30 years ago, the percentage is 0%. If you were born 20 years ago, the percentage of adults that identify as some part of LGBTQ is 20%. So it turns out that from 30 or 40 years ago, some meteor must have come and made everybody LGBTQ, because now there's 20% of young people identify in that population. So that, of course, that's not what it is. What it is that people are, young people are saying, we are different. We are, we accept our differences. We are going to be friends. We are going to make a difference. We are going to fight back from the administration. Like the 60s, that's happening again. And I think the young people, in my mind, are the power that we're going to utilize, the fusion power that exists, for this next, quantum leap into a better society is going to be driven by this environment of young people and their appreciation of what their environment is like if they don't have action.
I mean, I think on one side, Kim and the partners that developed this particular piece of work were maybe in the beginning having some barriers. And I say that because a piece of what we talked about, this is an incredible piece of work that took place, that's taking place. But one of the things that we talked about off and on all day was the piece about getting rid of the I and developing the we, and concentrating much more on the we. So I think sometimes, and this is Richard's outside observation, but a little bit out and a little bit in, is that some of the barriers that go along with that is obstacles that are put in place intentionally, or but many cases unintentionally, around how those partners, and with this as an example, can really work together. So I think that's one piece of that barrier. And I totally agree with Kim that this young generation, but let's just remember we were young at one point too. And what we've learned, and then the coming together within that partnership and pulling that academic piece together and the other connections to that is, what are you going to leave behind in the community? That's a piece of what we were talking about last night. And then we've got distrust of federal agencies and university institutions, because we've been researched. And then you have those additional kind of burdens. So then how do we collectively be able to take a piece of work like this and really lift it up and everyone feel ownership over it in terms of the practice, in terms of what happens, and then what do we leave behind to the community, but at the same time, that leave behind, how do we move forward? So I just wanted to compliment Kim and the team that worked on that, because I totally believe that it was an exceptional piece of work, and I think that the people may also. So thank you.
Are doing.
I think the answer to this problem is political. I've been following this hog farm situation for 30 years. I was down there that long ago, and nothing has changed. Smithfield Foods controls this whole hog industry in North Carolina. They put massive political contributions to keep their open sewers, their cesspools. They call them lagoons, but they're cesspools. And they're out there in the hot sun, and the poor people that live nearby are out of luck. They spray this feces into the air. It blows over on their homes. Those people have no conscience. And a Salisbury attorney recently took on the case of some of these people, and they divided her cases into 5. She won all 5 cases. The jury in every case decided in favor of the plaintiffs and against Smithfield. While this was going on, our state legislature, with a Republican majority, passed laws so that she cannot bring any new suits for other people. The laws have changed so that the justification for it is no longer possible legally. It's just a sad situation down there, and until the politics changes, nothing else is. The science is clear, the medical research is clear. It's now just a political problem, and unfortunately, most of the people of North Carolina never see that. If you live west of Raleigh, you don't even know about it. But the people down there are pretty much out of luck.
Thank you so much. Thank you, Kim, for your great presentation. If we could give him a hand.